I'm David Williams from the Health Business Group and the Health Business Blog. Welcome to the third edition of Health Business TV. It's been a productive and enjoyable week on my end. Today I'm going to briefly discuss a new board I've joined, medical inflation and my appearance on Al Jazeera America, health kiosks in the airport, the small group market for insurance, and hospital clowns. So earlier this week I went down to Richmond, Virginia, where I joined the board of a company called Home Care Delivered. This is a company I'm really passionate about because they focus on helping people with serious chronic illnesses to stay in their own homes. They deliver supplies for incontinence, for wound care, for ostomy, for urological disorders, and for diabetes. It's a very high-touch business, and even though it's small dollars in the scheme of the overall medical system, it makes a big difference when the customer hears from the Home Care Delivered customer service rep every month. And it's quite impressive. This company is the only one in the country that has a sole source Medicaid contract where they supply incontinence products for Virginia Medicaid, and they also have a Medicare competitive bid contract, a national contract for diabetes supply. So very differentiated, and I look forward to introducing them to various national health plans and to other state Medicaid agencies. So during the trip, I saw a health kiosk in the airport, and not only does it measure blood pressure, but you've probably seen these. They measure heart rate, and they measure weight, and they say several other things. And it's funny, it brought to my mind the old Create-A-Card kiosk that you used to see in drugstores where you'd go in and it would make a greeting card for you as a dedicated kiosk. It seemed like a little bit of a waste of time. I think it'll have a fairly short shelf life because I think smartphones are going to be able to do almost all of these functions in the near future. Blood pressure might be a little bit more of a challenge. PwC also made a big splash this week with a report on medical inflation starting to go up again. I'm not sure how much of a factor this really is. But in any case, I was on a show called Real Money with Ali Velshi on Al Jazeera America to talk about it. I said one of the things that was helping to drive up costs was powerful hospital systems that were working to raise prices with insurance companies. And as it turned out, Stuart Altman came on the show right after me and backed me up, although we never met to discuss it. Now, I mean, it seems to me that the cost of healthcare and the level of utilization went down because of the recession. Now, of course, it's going back up as the recession comes to an end. And the big question is, are we going to see things go back to the same level where they were? Or because patients and employers and even providers have become a little bit more conscious of the need to constrain costs, maybe things will settle in at a lower plateau. Along those lines, we saw a big decline in GDP in the first quarter. It was expected to go down just due to the lousy weather, and it seemed like that might have been a factor. But the big factor really was the decline in healthcare spending, which was somewhat unexpected. I do think that one of the factors might have been is people were just starting to get their new Obamacare plans and Medicaid. They may not have used it so much. Maybe that's going to go up over time as people start to use their insurance. Now, speaking of that, it appears that the premiums for the Obamacare exchanges are going to be rising next year. There's an average rise that was reported by Avalere Health of about 8%. And meanwhile, the increase for those biggest plans is going to be even higher than that. But because of the nature of the exchanges, it looks like it's going to be possible for most people to actually lower their cost from 2014 to 2015. They'll have to switch plans in order to do that. Meanwhile, I'm preparing for a webinar hosted by AIS on July 9th, which also happens to be my birthday. We'll be talking about insurer strategies for the turbulent small group market. I'll be joined on that webinar by a representative from Capital Blue Cross and also by a broker. If you're interested in signing up, you can click on the link below. And if at the checkout you type in all caps SAVE, S-A-V-E, $, and the number 75, you'll get a $75 discount. So finally, the highlight of my week was a big feature story on the Hearts and Noses Hospital Clown Troupe that appeared in the Boston Globe. I'll hold it up there for you. This is all about the work that the hospital clowns do in going into hospitals. They're professionally trained, and they work with children, and they also provide relief for the families who are under a lot of stress. I'm the chairman of the board of this organization. I've been involved with it for a long while. They interviewed our executive director, some of the clowns, and most importantly, they spoke with our medical director, who's a critical care doctor at Children's Hospital, and another board member who is a child psychiatrist. I'm very proud of the work that we do, especially for the very ill children, and also we're starting to work with children who are in locked mental health wards in hospitals, who usually get nobody at all coming to visit them. So I'm very proud of that. Next Friday is the 4th of July. I hope you'll be enjoying it. There will be no edition of Health Business TV for that reason next week. So until 2 weeks from now, take care.